Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the parotid gland. The parotid glands are the largest salivary glands. Okay. The parotid glands are the largest salivary glands. Okay. They are paired structure. So we have one parotid gland on each side. One is here, another one is there, and their secretion, they have serous secretion. Serous secretion, that means it is watery secretion. There are exocrine glands, so they have a duct. Okay, each parotid gland has one parotid duct, and the parotid gland is covered by a capsule. That capsule is derived from the buccopharyngeal. That capsule is derived from the investing layer of the deep cervical fascia. Okay, so the parotid gland has a capsule. The parotid gland capsule is derived from the investing layer of the deep cervical fascia. Investing layer of the deep cervical fascia. Deep cervical fascia. Okay, we got the idea about this paired salivary gland. We have other paired salivary glands are the submandibular glands and the sublingual glands. Okay, we got the duct is here. This is the parotid duct, and this is the capsule of the gland. Okay, this is the parotid gland, and this is the capsule. That capsule is derived from the investing layer of deep cervical fascia. Okay, now we go to the location of the parotid gland, where it is located. The parotid gland is located. Its location from the mastoid process to the ramus of the mandible, from posterior to anterior mandible. Or you can say from ramus of the mandible to the mastoid process. Okay, from the ramus of the mandible, to the mastoid process. Masseter process, the temporal bone. Okay, we got that. We got the extension from anterior to posterior, and also from the zygomatic arch to the lower border of the mandible. Okay, this is from above downward, from the zygomatic arch to the lower border of the mandible. Okay, so if we go to the skeleton here, this is the ramus of the mandible. This is the Masseter process. This is the external acoustic meatus. Our gland is located here. Okay, this is location above the zygomatic arch, below the lower border of the mandible. There is the extension from above downward, anterior posterior from the ramus of the mandible to the Masseter process. Okay, we got that. So it overlaps the anterior border of the sternocleidomastoid muscle. Sternocleidomastoid muscle. Okay, posteriorly. Okay, anteriorly it is over the masseter. Anteriorly it overlies on the masseter muscle. Okay, masseter muscle. So we got the location of the parotid gland. Okay. Now we'll discuss about the parotid duct. Parotid duct is very important to us. Okay. Parotid duct is a thick duct coming out of the anterior border of the parotid gland. Usually, if you do an X-ray cystography, usually two minor duct form one main parotid duct. Okay, the parotid duct is thick walled, around 5 centimeter in length. The parotid duct passes over the masseter muscle. Okay, and parotid duct has some relationship. Some structure is above the parotid duct. Some structures are above it. Okay, so some structure like we may have accessory parotid gland. The duct is here. We have the upper buccal branch of facial nerve, lower buccal branch of facial nerve. Okay, below the parotid duct. Above the parotid duct, we have the accessory parotid duct. Accessory parotid gland with its gland and its duct. Above this is the parotid duct. Suppose this is the parotid duct. This is the upper buccal branch of facial nerve. Upper buccal branch of facial nerve. We have the lower buccal branch of, this is below the parotid duct, buccal branch of facial nerve. Okay, these are the relationship. So we have the upper buccal branch of facial nerve above, the accessory parotid gland is above and its duct, and also we'll get another artery called transverse facial artery. Okay, that is also present here. The transverse facial artery may be a little bit lower here. We'll get here at this level. We'll also get the transverse facial artery. Transverse, that is above the parotid duct. Facial artery. So we'll summarize what structures are above the parotid duct. There is the upper buccal branch of the facial nerve, transverse facial artery, accessory parotid gland, and its duct. What structures are below the parotid duct? There is the lower buccal branch of the facial nerve. Okay, we got the relationship of the parotid duct. Now, parotid duct on its course over the masseter muscle, it passes over the masseter muscle. Then it pierces some structure to enter into the vestibule of the mouth. What structures are pierced by the parotid duct? At the anterior end of the masseter muscle, it goes medially inside, okay, and it pierces the parotid duct. That pierces the buccal pad of fat. Okay, it pierces the buccal pad of fat, the buccopharyngeal fascia. Okay, we got that. Then it pierces the buccinator muscle, buccinator muscle, and it takes an oblique course throughout the muscle. Okay, so it pierces the buccinator muscle obliquely. Okay, so then it passes between the buccinator muscle and the mucosa of the oral cavity, mucosa of the vestibule of the mouth, vestibule of the mouth. It opens where? Opens into the vestibule of the mouth opposite the crown of the upper second molar teeth. You must remember that. Opens in the vestibule of the mouth at the level of the crown of the upper second molar teeth. Upper second molar tooth on each side, on the upper second molar teeth. Okay, we got the parotid duct. Now we'll go structure passing through the parotid gland. Okay, what are the structure that passes through the parotid gland? Structures passing through the parotid gland. Through the parotid gland. Okay, what are the structures? From superficial to deep, these are the from superficial to deep, from superficial to deep. These are the branches of facial nerve, branches of facial nerve, that is the cranial nerve number 7. Okay, that is this. Then we get the retromandibular vein, retromandibular vein. Then we get the external carotid artery, its termination, retromandibular vein formation and its division. Okay, then we get external carotid artery. Okay, we got that. So these are three important structures. Those are present inside the parotid gland. This is the cross section of the parotid gland. Cross section. If you look at that cross section, this is the facial nerve CN7, cranial nerve number 7, facial nerve. This is the external carotid artery, external carotid artery. Okay, this is the retromandibular vein, retromandibular vein. Okay, and this is what structure? So we got the cross section. So this is the parotid gland. This is our parotid gland. Is here is the parotid gland. This is parotid gland. Parotid gland. And this is the ramus of mandible. Ramus of mandible. This is the muscle, medial pterygoid muscle. Medial pterygoid muscle, that is one of the muscles of mastication. We know that we have 4 muscles of mastication: medial pterygoid, lateral pterygoid, temporal is masseter. This is a medial pterygoid. Now what is this muscle? This is masseter. Okay. And this is what nerve? This is the facial nerve. This is this cranial nerve, facial nerve. Facial nerve, we got that. And this is the parotid gland, and it contains the facial nerve, the retromandibular vein formation, external carotid artery is termination. Okay, and this is what bone? This is the styloid process. Okay, styloid process. How about this bone? This bone, this is the mastoid process. Mastoid process. Okay, we got the cross section of the parotid gland, and the structure present there are the facial nerve, its branches, the retromandibular vein formation and its termination, division, external carotid artery is termination. Okay, so we got that. So let's start one by one. The facial nerve. Okay, inside the parotid gland. The facial nerve comes out of the cranial cavity through the stylomastoid foramen. It enters the parotid gland and it makes 5 branches. So what are the 5 branches of? 5 branches of facial nerve. Okay, just you can remember, we put we put the thumb on the temple and the index on the zygomatic bone. The middle finger is on the buccal muscle. On the mandible we have another branch, and the 5th finger would be on the cervical region, the neck. So temporal branch, zygomatic branch, buccal branch, then the mandibular branch and cervical branch. Okay, so we have the branches: temporal, we have the zygomatic branch, we have the buccal branch. Usually we have two buccal nerve, upper buccal, lower buccal. Okay. Then we have the mandibular branch. Then we have the cervical branch. Okay. These are the branches of the facial nerve that are, they may have anastomosis between them, and it has a lot of clinical importance, especially during surgery or removal of tumor. So surgeon always take care of the branches of the facial nerve. Okay. We have gone through the facial nerve. Now we go to the retromandibular vein. Retromandibular vein. Okay. So it is formed by the union of superficial temporal vein and the maxillary vein. Okay, this is retromandibular vein. This is superficial temporal vein. This is the maxillary vein. This is the retromandibular vein. Okay, and we will always get one transverse facial vein. Okay, retromandibular vein will be divided into two: anterior division, posterior division. Posterior division will unite with that of the posterior auricular vein to form external jugular vein. This is external jugular vein. This is the posterior auricular vein, and this is the anterior division of retromandibular vein. Posterior division of retromandibular vein is the posterior division. Okay, this is the anterior division. Okay, anterior division will unite with the facial vein to form common facial vein that will also open into the external jugular vein. This is the common facial vein. This is the facial vein. Okay, so this happens inside the parotid gland, the retromandibular vein. Okay, like this: superficial temporal vein, the maxillary vein, transverse facial vein, anterior division, posterior division, unite with the posterior auricular vein, external jugular vein. Anterior division will unite with that of the facial vein to form common facial vein that opens into the external jugular vein. Okay, we got the retromandibular vein as a content of the parotid gland. Then we'll go to the external carotid artery. External carotid artery. Okay. So if you go there again inside the parotid gland, okay, let me try here. This is the parotid gland. We make it perfect. Okay. So parotid gland is here. So external carotid artery comes inside the parotid gland through the inferior pole. This is the base. This is a pyramidal structure. This is the inverted pyramid the parotid gland is, and this is the base. So external carotid artery goes there. Two branches. One is superficial temporal. Another is the maxillary artery. And we may get transverse facial artery here. Okay. So usually it may not have the branch, posterior auricular branch. Posterior auricular branch may come inside the parotid gland, may or may not. It may be here at this level. So external carotid artery termination inside the parotid gland. What are the terminal branches of the external carotid artery? One is superficial temporal artery, another is the maxillary artery. So superficial temporal artery, suppose this is the number 1, number 2 is the maxillary artery. Okay, this is number 2. Number 3, we may get from the superficial temporal artery, we may get another branch inside the substance of parotid gland, transverse facial artery. Transverse facial artery usually we get as a branch of superficial temporal artery, and we may get the posterior auricular artery. This is number 3. Okay, number 3. Number 4, we may get the posterior auricular artery. Okay, it may be inside the substance of parotid gland, maybe lower than the level, maybe from here, not inside the substance of the parotid gland. So we got the structure inside the parotid gland. These are the facial nerve. We have the rectomandibular vein. We have the external carotid artery, and we must add one more group of structure. Those are the lymph nodes. Lymph nodes. Some of the lymph nodes are present on the capsule of the parotid gland. Some are in the substance of the parotid gland. So, as a content of the parotid gland, we may add the parotid lymph nodes. Okay, so some of them over the capsule of the parotid gland, some are inside the capsule of the parotid gland. We got that. Okay, so parotid glands. Okay, they drain lymph. You can say parotid lymph nodes. Okay, parotid lymph nodes drain lymph from the temple, from the zygomatic part of the face, the auricle, the buccal part of the face, okay, then certainly mandibular part of the face, mandibular part of the face, okay, and certainly from the parotid gland. Okay, these are the area of distribution, this entire part of the face. Okay, so where the parotid lymph node drains, into the upper deep cervical lymph nodes. The parotid lymph nodes drain into the upper deep cervical lymph nodes. Okay, we got the lymphatic drainage of the parotid gland. Okay, so now we'll go to the blood supply of the parotid gland. To say it again, parotid gland contains multiple structures, and a significant part of the lymph nodes are present inside the parotid gland, some of them outside the parotid gland. So what is the blood supply of the parotid gland? Blood supply is very easy. These are the branches of the external carotid artery, the terminal branches which are inside the parotid gland. Venous drainage is like that, by the rectomandibular vein and its division, that will they will manage the venous drainage of the parotid gland. So artery and the vein which are present inside the parotid gland will serve that purpose. Blood supply by the external carotid artery, venous drainage by the retromandibular vein. Okay, how about the nerve supply? Parotid gland is a salivary gland. It needs secretomotor function. So the parasympathetic is for secretomotor function. Secretomotor function. That means parasympathetic stimulation will increase the secretion of the parotid gland, and that will be serous gland because it contains serous acini. Okay, this is watery, not sticky. The secretomotor function, and parasympathetic stimulation, there will be copious secretion of the saliva from the parotid gland. It will be thinner. Okay, so what is the source of parasympathetic nerve supply? Okay, parasympathetic, it should come from the inferior salivatory nucleus. Inferior salivatory nucleus, that is present at the junction between the pons and medulla oblongata, lower part of the pons and upper part of the medulla oblongata. From there, it will go to the ninth cranial nerve, that is the glossopharyngeal nerve. Glossopharyngeal nerve. Okay, then we'll get the tympanic nerve. Then we'll get the tympanic plexus. Then from tympanic plexus, we'll get the lesser petrosal nerve. That will go along with the mandibular division of trigeminal nerve through the foramen ovale. It will go to the otic ganglion. Okay, to the otic ganglion. So there will be a relay there. There will be a synapse there. So preganglionic fiber will end up. This is the preganglionic fiber. The otic ganglion will have the postganglionic fiber. The postganglionic fiber should go through the auriculotemporal nerve. Auriculotemporal nerve. So this is the parasympathetic. How about sympathetic? Okay, sympathetic. Sympathetic again will go to the superior cervical sympathetic ganglion. Here we will have preganglionic neurons. From here we will get the postganglionic neurons, the fibers from there. Okay, it will go through the plexus around the postganglionic fiber from the superior cervical sympathetic ganglion will go through the plexus around the external carotid artery, and that will be distributed by the auriculotemporal nerve, temporal nerve. Okay, it is a branch of the auriculotemporal nerve, is a branch of the mandibular nerve. So sympathetic stimulation will cause decreased secretion of the parotid gland. It is vasomotor. It is not secretomotor. It is vasomotor. Okay, this is vasomotor, and it will decrease the secretion from the gland, from the parotid gland. So secretion will be thicker. We got sympathetic innervation. Now we'll go to the sensory innervation. Sensory innervation by auriculotemporal nerve. There is a branch of the mandibular nerve, auriculotemporal nerve. Okay, sensory innervation. But the sensory innervation to the capsule of the parotid gland is carried by the great auricular nerve, okay, to the gland. Okay, so for capsule we have sensory innervation from the great auricular nerve. Okay, that is C2. We got the nerve supply. Now we'll go to the development. Development of the parotid gland, embryologically it is coming from the ectoderm. From the proliferation of the buccal epithelial cell. From the proliferation of the buccal epithelial cells and contributed by neural crest cells. So it is ectodermal and this is the way it develops. We got the development of the parotid gland, the embryology. Okay, and this is a serous gland. It should contain serous acini histologically. Okay, now we'll go some of the clinical anatomy of parotid gland. Clinical anatomy. Okay, parotid gland may be inflamed. Inflammation, it is painful. Inflammation by viral infection like mumps. Okay, there may be some infection that may be due to trauma, damage, may come from the blood, or it may come from the mouth cavity due to bad oral hygiene or bad dental hygiene. We may have infection and we may have tumor that is mostly benign tumor but maybe malignant tumor. Okay, we got that. So there may be inflammation, infection, tumor of the parotid gland, and it's because it is covered by a capsule, so any abscess formation, inflammation cause pain to the parotid gland. Okay, we got that. So these are the problem with that of the parotid gland, but we have to give emphasis on another important clinical condition. Okay, clinical syndrome that is called Frey's syndrome. Frey's syndrome. Okay, also called auriculotemporal nerve syndrome. Auriculotemporal nerve syndrome. Okay, this happened due to damage to the parotid gland by surgery or any type of trauma. Okay, lesion to the parotid gland. We can call lesion to the auriculotemporal nerve, that will be better. Auriculotemporal nerve, especially during the surgery, auriculotemporal nerve. What will happen? The nerve, when they will regrow after that damage, when there will be regrowth of the nerve, the parasympathetic nerve fiber will unite with the sympathetic nerve fibers during regrowth of the damaged nerve. what happened? The parasympathetic nerve fibers will anastomose with the sympathetic fibers. Sympathetic, parasympathetic, both type of fibers are present in the auriculotemporal nerve. Sympathetic fibers are also present in the great auricular nerve, supplying the sweat gland. So person attempt to eat something, there will be excessive sweating around the auricle, because due to that stimulation, parasympathetic nerve is connected to the sympathetic nerve fiber during the regrowth or regeneration of the damaged nerve condition. So on eating, there will be sweating. On eating, there will be sweating, especially around the parotid gland, around the temple or auricle. So that is another clinical important. And we just mentioned previously, facial nerve branches may be damaged. Nerve branches is very important. Branches may be damaged in parotid surgery. So surgeons should be very alert about that, because facial nerve branches does not supply the parotid gland. Facial nerve branches should supply the muscles of facial expression. So any damage to the facial nerve, suppose this is the facial nerve here, facial nerve, temporal branch, the zygomatic branch, the buccal branch, the mandibular branch, the cervical branch, there may be anastomosis between them. So that will cause facial paralysis following a surgery to remove a tumor from the parotid gland. So that's all about the anatomy of the parotid gland. If you like my video, please support my channel, please subscribe me. If you have any question, please feel free to ask me. Please share the information with your friends. Again, I am requesting you, please subscribe me. Have a nice day. Bye now.